Hello, everyone, and welcome to the latest edition of ECD Live. It is now my pleasure to turn the floor over to Deputy Assistant Secretary for Early Childhood in the Office of Early Childhood Development, Katie Ham. Katie, the floor is yours.
Thank you so much and welcome everyone. It's so nice to see a great crowd here with us today, especially in August. We know it's a busy time of year for everyone, so we are grateful for your time today. As a reminder, this is a monthly webinar hosted by the Office of Early Childhood Development at the Administration for Children and Families in collaboration with the Department of Education, the Office of Head Start, and the Office of Child Care. Each month we provide this webinar and it's open to everyone across the country. We encourage national and state leaders to join, as well as early educators, family child care providers, parents, early childhood professionals in home visiting, Head Start, and early intervention. We do record each and every webinar, so those of you who aren't able to join us live can watch it later. The goal is to provide the latest information on the American Rescue Plan and how the early childhood community can support response and recovery to the COVID-19 public health emergency. We also share information on our longer term proposal, the American Rescue Plan, and how that can benefit children and families, especially the child tax credit, which can provide benefits to family on a monthly basis, and that's already underway. Last month, we shared how the administration's long-term plan for early childhood would benefit children, families, providers across the country. It's called the American Families Plan and the Build Back Better agenda. And as we discussed during our July webinar, the president has proposed an unprecedented $450 billion for early childhood. The plan would address wages for early childhood providers, family child care providers, and early educators. It would invest in funding to support quality across the board, and it would significantly expand access for families while reducing their costs. And importantly, this proposal is a mixed delivery system that includes family child care centers, Head Start, and schools. And family child care providers would be able to participate in both preschool as well as the child care proposals. We're going to hear more about the American Families Plan and how you can get more engaged from the White House about that today. In addition, this month we're going to be talking more about the early childhood workforce. We've heard from many of you across the country in the child care, Head Start, and preschool communities that finding qualified staff is a real challenge right now. And as some of you prepare to go back to the school year and at the end of the month or in September, we've heard that you are very much struggling to find and recruit staff. We want to acknowledge that while this is an ongoing challenge, we have made some progress. Since President Biden took office in January of 2020, we've added nearly 65,000 child care jobs. We are now at 89% of the pre-pandemic level in terms of childcare staffing. And the Administration for Children and Families released guidance that strongly encourages that states use their American Rescue Plan funds to increase payment rates to childcare providers and increase wages for staff. We know that this is just the beginning of our efforts. We know that we need to invest in the early childhood workforce, both in the short term and fix the systemic issues in the childcare sector that have created chronically low pay, and increasing wages is an incredibly effective and important way to do that. Over the long term, this is exactly why President Biden has proposed the Build Back Better agenda that centers investments on early childhood and the workforce. But we want to also talk to you today about some resources that states have that they can use to address the problem in the near term. So we're going to hear from Dr. Ruth Friedman in the Office of Child Care and Dr. Bernardine Chitral in the Office of Head Start about how you can use some of those resources that states have to address recruitment and retention of highly qualified staff. We also wanted to make sure that everyone is aware that last month, the Centers for Disease Control and Prevention issued guidance specifically for early childhood programs. We will put the link in the chat. We know that all of this is very top of mind as everyone assesses what policies and procedures they need in place to prevent the spread of COVID-19. We hope this guidance is useful to you, and we're happy to answer any questions if you submit those. We'll try to get answers to any questions that are still lingering. So today we're going to talk more about the workforce. We received some great questions on apprenticeships, alternative workforce development, opportunities, student loans. We know all of these questions are very top of mind. We're going to try to answer what we can today, and also looking forward to continuing the conversation with you as we think about the workforce and as we think about the opportunities we have in the coming months to really solve for some of these problems and put together a longer term in place. Right now, I'm pleased to introduce Grace Landrieu from the Domestic Policy Council at the White House. Grace is the Director of Workers and Labor Issues in the Domestic Policy Council. She was previously on the presidential transition team, as well as the president's presidential campaign. She has been working very closely with staff at HHS on the American Rescue Plan and the American Families Plan. And she's going to share a little bit more about the American Families Plan and what the president envisions as our long-term Build Back Better approach for early childhood. Grace?
Thanks, Katie, and thank you everybody for having me here. As Katie said, I work on the Domestic Policy Council. I oversee our childcare and preschool work for the council and have been working very closely with ACF on the President's Build Back Better plan. Katie noted that I had worked on the campaign, on the president's campaign, and I think it was a pretty historic moment when he as part of his economic recovery package announced that he wanted to prioritize childcare as one of the big pieces of his economic recovery. Generally, as y'all know, economic recoveries are focused on roads and bridges, and he really expanded, I think, the public priority on at a very high level on this, thanks to the work of many of you and others on the phone who have for very long been shouting about how important this childcare is for, and preschool are, for people to be able to go to work, for the economy to function, and of course for children's long-term impact on children. So thank you all for all of your long advocacy on that. I think this week is pretty, hopefully the start of a pretty, and more, continuing on that historic train with the budget resolution that Congress, that the Senate is taking up right now. They are currently working on they put forth a $3.5 trillion budget resolution, and they're currently working on that on the floor this week, which I think is really exciting. That under that 3.5 trillion will include investments in Build Back Better priorities, and we fully expect a robust childcare and preschool investment to be part of that. So we're really excited as this is moving through Congress. We are working closely with ACF and Congress and getting this done. And we'll need all of your support over the next few months, or hope for all of your support in making sure that we are continuing to highlight the importance of these types of investments. The president has called for investing in guaranteeing low and middle income families access to high quality, affordable childcare. We think it's going to save most families half of their childcare costs, and it's and on higher quality care than many families are able to access now, which we are really excited about because it will produce lifetime benefits for kids, and providing more access to parents. We think it's going to be really important for an equitable recovery. In addition to that, he is proposing parents can take advantage of a subsidy program where it's their childcare costs will be kept at 7% of their income on a sliding scale. They can alternately choose to take advantage of the child and dependent care tax credit under his plan. This is currently expanded under the American Rescue Plan, so parents can actually benefit from it right now. So if there are ways to raise awareness to make sure that people know that they can benefit from this now, get childcare now, and for parents who think it works better for them, they can choose that over the subsidy plan. That will be an option. That'll benefit, whereas the subsidy plan is for birth to 5. The tax credit is for families that are benefit families that have school-age kids as well, and some families that are higher, a little bit higher up the income scale. Families receiving up to 125,000 will get a half credit back, without those up to 400,000 getting a credit as well, at least as generous as it is today. He has called for expanding investments in facilities to make sure that we have the supply of care, both making direct investments and in providing tax credits for businesses to provide on-site care. He has called, really importantly, like a critical part of his plan is to make sure that workers are paid wages that are higher and commensurate with what their skills. So with providing a floor of a living wage, but making sure that they also are earning as much as kindergarten teachers if they're comparably qualified. We think that that's going to be, as Katie was saying, there are problems with, we are very proud of the work that has happened under this administration, getting childcare providers, providing funding to the childcare providers can be stable and attract a workforce, and to think that there's a lot of money in the American Rescue Plan that can help increase wages. This plan will hopefully continue that and improve it at higher levels and make sure that there's enough funding in the system for that, to make sure that a well-trained workforce, as everybody in this call knows, is essential for not only for the workforce but also for quality of care. In addition, the president has proposed a universal preschool for 3- and 4-year-olds. All of this is a mixed delivery system. It is going to support families to have the choice from sending their children to family child care, to child care centers, to Head Start, to others. It is building on, the point is it should be building on the existing infrastructure that currently exists in both the child care and the preschool programs. I think those are all of the top lines of our child care and preschool programs. He's also, the Build Back Better plan, I think, is exciting for families in many ways. It expands the child, it would extend the child tax credit and other supports, but those are the primary investments and things that we're very excited about. I think it's going to make a historic change and both in the lives of children, but also in increasing labor force participation, our American competitiveness, making the economy more equitable. So I think we're really excited about this plan and are very happy to hear all of your input and thoughts on it. Katie and Ruth, I don't know if I missed anything.
Thank you so much, Grace. That was a great overview, and it's just so nice to be able to hear a commitment to the early childhood workforce and to wages coming from the top. So we really appreciate your leadership and the president's leadership in this space. We're going to turn now to Dr. Ruth Friedman, who's spoken before in this forum about childcare, and she's going to cover some of the ways that the American Rescue Plan can be used to support the early childhood workforce. Ruth, I'll turn it over to you.
Thanks, Katie. Good afternoon, everybody. I'm happy to be with you guys again. Good afternoon and good morning to our friends in Hawaii. So our focus today really is on workforce and professional development and wages and what possibilities there are. I know you guys have already heard us talk about how much funding has been made available to states. Most recently in March of 2021, the president signed the American Rescue Plan Act into law, which created $39 billion for childcare. That includes a $24 billion brand new program to stabilize the childcare sector and about $15 billion in supplemental CCDF funds. And that is also on top of the $10 billion that was passed in December of 2020 as part of COVID relief. Katie mentioned that we are making great progress in helping stabilize the childcare sector in the past 7 months, but there is still a lot of work to do. And I know you guys know that on the ground as well as anyone. Childcare is just essential for our communities to thrive. but we're in a situation where families cannot access or afford high quality care. Providers operate on razor thin margins, and the workforce is just desperately underpaid for the skilled and valuable work that they do. And we think this is such an important leverage point to change and really continue to encourage states, territories, and tribes, our lead agencies in the CCDBG program, to use the flexibilities in the money that has been recently appropriated to address these wages issues. We know that low wages makes it difficult to recruit and retain skilled workforce, and just undermines every aspect of the childcare sector and the families and children trying to be served by that sector. So specifically, I'm happy to say that we now have 8 states with live stabilization grants: Connecticut, Delaware, Maryland, Illinois, New Hampshire, New Mexico, New York, and Oklahoma. And over 10,000 applications have been received from providers in those states. So that is great progress. Many of these states have designed their grants specifically to increase the wages of childcare staff. The way the ARP program works is states have a great deal of flexibility in how they design these sub-grants to providers. And we at the Office of Child Care continue to strongly encourage and put out guidance, helping states figure out ways to design these grants to be sure that they can use their funds to support providers in ways that are just really essential. These stabilization grants are allowed to cover and increase wages and benefits for childcare personnel. That includes compensation, that includes benefits like health, dental, and vision, scholarships, paid sick or family leave, retirement contributions. Raising the wages is really central, I think, to our efforts to strengthen the system in really core and fundamental ways. We also know that states have begun to spend other federal funds, as well as prioritizing their own general revenue to raise wages, provide training, and help more families afford the care that they need. And this is great news. States have begun to use both their CRSA and their ARP funding to do things like provide free training to child care providers through the next year, to support wage bonuses for the workforce. We know that there is money already dedicated to providing mentorships and scholarships to pursue advanced credentials for childcare workforce, as well as trainer academies. And so we are really pleased to see the various ways that states have been able to start using these funds and plan in the coming weeks and months to help elevate some of these examples so that states can be learning from each other about the different ways they can help support their childcare workforce. And so with that, I'm really excited to welcome our presenters today from the Team Inc., a program in Waterbury, Connecticut. We have David Morgan, who serves as president and CEO, Yvette Cartagena, who serves as the family support site manager, and Maria Rodriguez, who is an enrolled parent at Team. Team is a private, not-for-profit human services agency whose mission is to strengthen communities by educating, supporting, and empowering individuals and families. Team provides services to multiple communities across Connecticut with early childhood and Head Start services. And today they will share with us their strategies and efforts in utilizing COVID relief and ARP stabilization funds. And with that, I think I'm going to hand it over to David.
Thank you, Ruth. Thank you, everyone. And I believe some slides will be coming up. And, from all of us at Team, including Yvette and Maria and the staff, we're just very inspired to hear once again the updates and the commitment to early childhood. I've been a lifelong professional in the field of early childhood, coming out of the University of Connecticut as a toddler teacher and moving through the ranks, and blessed with the opportunity to lead so many heroes, including Head Start, childcare, family childcare, early Head Start, and other partnerships deeply committed to early childhood. And while we're waiting for the slides, I'll just touch on, oh, here we go. And again, TEAM is a nonprofit early childhood and human services provider. And our footprint covers 12 towns and cities in South Central Connecticut. And these are our headliners on how, you know, and my general theme will be what we have done, what we're currently doing, and what we're striving to do with this amazing lifeline and relief funding from the federal COVID-19 relief funding. And so these are our headliners, and I'll dive a little deeper into each of them. But number one, staff compensation, and in the form of premium pay, and I'll talk more about that. Personal protective equipment, cleaning and sanitation supplies and services, other equipment and supplies to respond to COVID-19, facility improvements, both indoor as well as outdoor learning environments, as well as mental health supports for children, families, and staff. And on our slides, you'll see different images of our Waterbury location where we're shining light on our work. Next slide, please. So our site in Waterbury, again, is a Head Start and childcare commitment in partnership with the state and federal funding opportunities from both the Office of Head Start, Office of Childcare, State of Connecticut Office of Early Childhood, and other public and private partnerships. Our location, we're licensed, and these criteria I put on here are what were really very critical when we were applying and pursuing for the American Rescue Plan funding specific to childcare stabilization. So we're licensed for 224 children, and of that included 72 children under the age of 3, infants and toddlers. Our location is accredited, Head Start approved designation, both at the state and federal level. We have been, and we're continuing to operate and serve children and families amidst the devastating, scary realities of the coronavirus pandemic. We're 14 months in and going strong, not without challenges, not without stresses and anxieties and uncertainties, but a lot's at stake. And you know, many have learned what a critical element, I would argue the most critical element to the economic vitality, as we heard earlier. I couldn't agree more. Is childcare and the opportunities for children and the families that surround the children. You know, childcare works so parents can work. So we've been operating for 14 months. We are operating full time with the state of Connecticut and with the federal and state funding relief. We actually are exceeding the threshold of more than 30 hours per week. We're open Monday through Friday, year round. 100% of our classrooms are in operation. The minimum threshold with the application process through Connecticut and through the feds was at least 50%. And then lastly, the social vulnerability index, specifically really trying to provide help to those who really need it the most. And when you look at Waterbury, it ranks, I'm sad to say, amongst the highest concentrations of poverty in the state of Connecticut. 39% of young children under the age of 5 in the city of Waterbury are below the federal poverty level. Waterbury ranks number 3 out of 169 towns and cities, with the greatest amount of toddlers below the federal poverty level, and number 4 in the state out of 169 as far as total population in the city of Waterbury that is at or below the federal poverty level. And the disproportionate impact when you look at race, ethnicity, gender, especially on people of color and women, is very apparent. And so when you look at the social vulnerability index and the formula through the application, Waterbury and Team's Head Start in early childhood initiatives, we were able to pursue and leverage that as well. Next slide, please. So just a couple of headliners within each of the earlier ones that I shared. So staff compensation, Again, the Connecticut Office of Early Childhood's Child Care Program Stabilization Funding application, through the federal COVID relief funding, had the option to pursue an additional 25% of the funding to provide compensation to staff. And not without challenge, but we were able to pursue that and opt into it and leverage that additional monies. And as we heard earlier, it's very challenging when we know the science and the research is very clear about early childhood. And I'm singing to the choir here. We know that children are born wired for feelings and ready to learn. We know there's more rapid brain development from birth, prenatal to age 3 than throughout the remainder of the entire human experience. We know young children's brain is at 90% development capacity by the age of 5. It starts in early childhood. I would say to you, the corpus of our entire quality of life and our human connections and our experiences as a people begins with early childhood. And so it's, in my opinion, the greatest tragedy when we think about how uncompensated and how underfunded it is. And again, I'm singing to the choir here, but that's why I'm so inspired to hear the messages and the commitments to childcare and early childhood. And my point is this: when you're pursuing COVID-19 relief funding, a strong recommendation of any opportunity you can leverage funding to get it straight to the staff, seize it. And there are a lot of ideas around tuition reimbursement, healthcare reimbursement. As we looked at this and worked on it, our belief was give it to the early childhood professionals and let them decide how best to use it for themselves and their loved ones. So we were able to leverage it in the form of a one-time premium pay compensation added on top of their standard wages. And that I see a lot of questions coming up about, well, how do you increase a wage rate if this is one-time rescue funding? And that's a very good question. Premium pay solves that. Give that lump of premium pay to the staff. They have borne and they continue to bear the greatest increased health risk as part of the emergency response. And so we actually just finished executing that, and we're really proud of that. Again, staff pour themselves. There's no larger lifeline to the work of early childhood than the staff who pour themselves into this very complicated work, working with young children, colleagues, families from all walks of life. For all of us at team, every conversation should begin and end with the compensation dilemma for the workforce. PPE, cleaning and sanitation environments. So we were able to commit to increasing the number of sanitizing machines, Zono machines, our ability to sanitize cots and learning materials. You name it, we could put it in that machine. We even increased laundry services. We got additional laundry machines and dishwashers. Our ability to increase the frequency of cleaning and sanitizing equipment. Again, when you're operating every day, year round, and you need to rotate materials, rotate learning materials, you have to have a very rigorous, robust approach when you're addressing health and safety, amidst this public health crisis. So we were able to do that with this federal relief funding and continuing to do it. We also purchased additional educational materials for rotation and cleaning and sanitizing. So as you're going through those routines throughout, every minute and hour matters, and young children from just months old to 2-year-olds to 3, 4, pre-kindergarten, preschool age children, because there's such an increased frequency of rotation of materials, you're going to need more educational materials to ensure that bar of quality for childcare and Head Start and early childhood. So we were able to purchase more educational materials. And then lastly, we reconfigured our classroom layouts, our indoor learning experiences to promote increased social distancing to the maximum, feasible possibility. We recognize the challenges with that with young children, but also how children and staff are coming together and eating, as well as sleeping times. Next slide, please. And then I want to focus on outdoor learning experiences. You can see some of the images of our outdoor areas. Never lose sight. And again, the science and the research is very clear that children's learning opportunities and experiences equally, and in some cases even more so thrives when they are in an outdoor experience. So never look at it as a time of respite or a recess, but actually another way to maximize young children's development and learning experiences with one another, with the staff, and with themselves. And so to that end, we are working on expanding and thinking out of the box and broadening the outdoor classroom learning experiences due to COVID-19, as well as trying to, when we think of indoor, trying to keep our eye on the horizon. If there does become a full commitment beyond the long-term recovery of COVID-19, how do we increase capacity for childcare? There's such a significant resource deficit, specifically to infant toddler capacity for families who are really looking for that childcare so they can go to work, continue to go to work, pursue vocations in education. And so we're also looking at internal capacity building as well. And then lastly, mental health and other supports. You have to equally think about children and families as well as staff. Again, children, we know, are born wired for feelings, and we can't help but think about how children, yes, are very resilient, but how are they taking in and processing this new world that we all find ourselves swimming through, and what COVID-19 is doing to families and to staff, especially staff who are so overworked yet so underpaid. COVID-19 is affecting every part of their lives, every part of your lives, every part of our lives. And so how do we double down on strategies like EAP for employee assistance programs, for example? How do we create one-on-one opportunities to support staff well-being, small groups, story circles, opportunities for staff to be able to think about self-care, and what can we as providers, as supervisors, employers, as governing bodies, be very deliberate and intentional about thinking about the emotional well-being, as well as the physical and behavioral well-being of staff, as well as children and families, as we continue to try to internalize this. In the next slide, please. This last slide, we like to, we wanted to put this here because it's surreal for all of you and for all of us to think that we're still swimming through some dark realities of the coronavirus pandemic, and it is certainly not sunsetting. It is certainly not going away. And what always inspires us at Team is our capacity to think out of the box, that we're in this together. And you don't need to look any further than early childhood when you think about the helpers. And we offer two quotes to you. One is from Mr. Rogers and his mother saying, in such times of disaster, look for the helpers. And we all know and can remember, as this pandemic, I'm not sure, I don't even have the words for it anymore. It came crashing down on all of us in early 2020. You didn't need to look beyond childcare and Head Start and early childhood professionals while the world was bunkering down and sheltering in place. Early childhood was the helper and was there to hold the line for so many children, so many families, and so many neighborhoods and communities. And then I'll add the other piece that we actually got sent to us, and it's a note in the upper right. And this is a 10-year-old whose sister was in a childcare program at Team. And imagine a 10-year-old, we got this in March of 2020, right at the end of March. And yes, it says Dear David, but it's really addressed to all the early childhood professionals and human services workers at Team. And imagine a 10-year-old seeing the scary headlines and the images, the loss of life and the impact to health and economics. And she took the time to look up Team and write this letter about humanity and the helpers. And, we think of, during these scariest times, and we're trying to be the best for ourselves, for the children and families, and for one another. We often like to think about what Mark Twain once said, where kindness is the language which the deaf can hear and the blind can see. And with that, I'd like to take off the slide and introduce two of our champions at Team, Yvette Cartagena, who's the family support site manager at Team, as well as Maria Rodriguez, who is a parent, a mother, a strong leader with our advisory work here at Team, who has had 2 children come through our program, 2 daughters. One has exited and gone on to elementary school, and the other is still with us. But I think what matters most is hearing straight from the heart of, the family. That's the family is the center of everything. So I want to hand it off to Yvette and Maria for some closing thoughts on your experiences with this.
Good afternoon. I'm Eva Cartagena and I work for Team. And I just wanted to share just a little bit about the fact that our families appreciated that our doors were open to them to allow them to work. Because, as you know, it's very difficult to be able to leave your baby safe somewhere. And knowing that we are cleaning this, how do we approach the COVID? They were comfortable enough to actually leave their children with us. And so as a family, we have to be there for everyone that goes into our program, because as you know, it's very difficult in normal times. This is not normal times. Our families want to be able to feel comfortable leaving their children where you're keeping the environment safe. And of course, as you know, Pandemic Acts is asking so many questions just to keep our children safe. So I just wanted to thank everyone that is part of allowing us to keep our children safe and letting our parents continue to work, because they still do need to work in order to make their everyday life a little bit much better. So I didn't want to say too much, but I just wanted to say thank you. And I'm glad that we're part of keeping our children coming to the program and then keeping our families working in order to provide for their babies. And I just wanted to introduce Maria Rodriguez, who is one of our parents in our program, and she wanted to also speak a little bit. She will speak sometimes in Spanish because it's whatever her passion is. And sometimes the passion comes in your language. So I would just like to introduce her. Maria.
Buenas tardes, mi nombre es María. Estoy, como dijeron antes, tengo dos niñas. Una ya salió del centro y la otra está aquí. Me siento muy a gusto de estar con ustedes aquí esta tarde y decir que el centro ha estado trabajando muy duro con referente a toda la situación del COVID. Creo que me siento muy segura con todo el protocolo que lleva hasta ahora el centro y de mi parte está poner mi granito de arena para seguir ayudando y poderle dejar saber a otras amistades que ya tienen a sus niños aquí y lo han aceptado, que todo va a estar bien, y creo que el centro hace lo mejor que puede para que todos estén a salvo.
Thank you so much. Very, very appreciative of your time and sharing more about your wonderful program. It's great to see the impact that these resources are having on staff and families. And Maria, we especially appreciate you joining and sharing more about your experience with us. So thank you to you all. We're excited to hear where you take your program next. It's great to hear from you all. I am now going to turn it over to Dr. Bernadine Chitral, who's the director of the Office of Head Start, and who is going to share more about how the Head Start funding can be used to support the early childhood workforce and for other purposes to bring back all of our Head Start students to in-person services. Dr. Chitral?
Thank you so much, Katie. And hello, everyone. I'm Dr. Chitral, the proud director of the Office of Head Start. I do want to thank you, team, for your leadership. You are an example and a key part of the day-to-day work that's changing lives across our nation. I thank you for your presentation and for coming to share your story. You all are essential, and I want to thank you so much for what you do, what you sacrifice, and the impact that you are making. I joined today to talk a little bit about some of the ways that Head Start programs can use the ARP funding to support the workforce. Next slide, please. To start, I just want to share with you, this is a graphic. It's an example. It's a big brain of all the ideas and the ways that we tried to make it very clear and flexible for Head Start programs to use the ARP funding, with the goal and the belief that it's going to take information from the local level to build back towards in-person services And so we want to support our Head Start grant recipients and our programs across the country to make the best decisions for their local areas. And so the IM that we issued included this language to have this broad flexibility while also pointing to a few key areas like making sure our facilities are ready, ensuring that our staff and our workforce is supported, and also ensuring that we build back towards in-person services. So to that end, this is what this graphic does, but in no way is it a complete list of all of the things that programs can use the ARP funding for. So what I'm going to do is going to highlight quickly just a few examples, including that using the one-time, how you can use the one-time funding, like for staff wellness, mental health support, and then also maybe reconsidering ways that your workforce is organized as well. So the next slide, please. I do want to pause as I begin this conversation, just recognize where we are in the pandemic. First, COVID is not over, and we are still in the pandemic per the Public Health Declaration. And so as partners in this work, working with across our nation, working with communities, I'm asking you to do your part to keep yourself safe, to keep others safe, and to really get our Head Start workforce, our childcare workforce, our entire workforce vaccinated, as that continues to be the most important mitigation strategy. And at Head Start, as well as all of us that work with young children, we do have an added weight to get our workforce vaccinated because young children are not yet eligible to receive a vaccine. And so what we're doing at the Office of Head Start is pushing out more information on our Sleeves Up for Head Start program to share factual information about COVID-19 vaccines for staff and families. I encourage you, programs and others, to use the ARP funding to coordinate access to vaccines for staff, hosting vaccine drives at your facilities, or working in partnership with local pharmacies or other providers to make vaccine access available. You can also use the ARP funds to help staff who may have to take time off to take off to get the vaccine or to have to recover from the effects of getting the vaccine. So I want to lift that up also. I do just want to pause really quickly and just focus on some of the racial disparities that we are watching and seeing with the data and the death and the vaccine rates within COVID-19. And that's important for our Head Start children and families, but also our Head Start staff. And so I want to remind us of just that importance and making sure that even though this virus has exposed many systemic issues within our structures that we know and trust, I do see this as an opportunity for us to be united in our approach and to get more people healthy and safe. And so we are focusing on health equity within Head Start by working with all of you and having conversations like the ones we're having today concerning the workforce. Next slide, please. In addition to getting everybody vaccinated, thank you, it is critically important, as you heard earlier, to prioritize the workforce regarding wellness, mental health, wellness, physical, providing incentive pay. And I'm so proud of the many stories, the one we just heard, as well as the many stories from programs that are really prioritizing the workforce. I know a program in Virginia that coordinated making sure everyone had a Fitbit and they synced it up so that they could just track physical activity, especially during some of the darkest days in the beginning of the pandemic, just so that people could feel connected and prioritize. And yes, these are one-time funds, as was mentioned, but there's incentives that can be used to really address and providing some of the incentive pay for the workforce. Next slide, please. The final is a reminder, and it's a connection to just the main point. In order to get back to in-person services, we have to start with our workforce. We have to start with our staff. As members of my team, we call it our people, to get back in person. Healthy leaders lead healthy organizations. Healthy staff are ready for healthy communities. And so we want to make sure that as we talk about getting back to in-person services and we're doing that work, we want to be clear and we lean into the word of ramping up to know that what our intent is at the Office of Head Start is to ensure that we are building back stronger, better. And so that means pausing and checking in with our staff to ensure that they're comfortable. Do things like purchase items like face masks, filters. You can also use funding to provide necessary clarity around what the plans are, or even to co-create and develop plans with your team by using external partners. And so I just want to remind us, as we think about reaching more children and families, as we think about getting our facilities and things in place, we want to begin with the workforce. You want to bring your workforce in before the children and families come back so that we know that they're comfortable and you can be responsive to the needs. Next slide, please. And finally, this topic is one of many conversations that many of us are having across HHS, as well as ACF, et cetera. But it's because the work that our workforce does is essential, as was mentioned. And we want to do all that we can to amplify and support and strengthen our workforce. So as I close, I just want to point out a few upcoming events that we have coming the week of the 24th that really speak to some approaches to staff wellness. The first is the 24th. It's going to be a webinar around program approaches to staff wellness that you can really understand some other ways outside of ARP that we can use to support staff right now. We have our final in the first series on August 25th of a Head Start Forward webinar coming up, where we're going to showcase some effective examples from Head Start programs across the country. And then finally, we have our live chat-a-thon, because yes, the child tax credits are important. We also know getting that information out and getting it clear and being able to understand it is necessary. So we're having what we call a chat-a-thon on August 26th. And so with that, again, I want to thank you for all that you do in partnership with us, and on behalf of the entire team of the Office of Head Start, I say thank you. Thank you. Katie?
Thank you so much, Dr. Chitral, for that helpful information. Now I'm very pleased to have the opportunity to introduce Miriam Calderon, who is my counterpart at the Department of Education and is going to share some more information about the ways that the Department of Education is supporting early childhood and in particular the workforce. Miriam?
Hi, Katie. Thank you so much. I'm thrilled to be able to join everyone. This really important conversation about the workforce. So as Katie said, I wanted to just give several updates and really touch on four key points from the Department of Education that I want to make sure everyone is informed about. I think there are key opportunities to support early childhood educators, and I think our shared goals, many of which you've I know have been touched on this webinar so far this afternoon. So the first is I want to share that the department has opened up a comment period on the public service loan forgiveness program. So on July 26th, the department invited public comment on this program. We're really interested in understanding more about borrowers' experiences and other policy considerations that we should take into account in improving access to public service loan forgiveness. I think as we all know, there are a significant number of early childhood educators and staff, particularly women of color, that have significant debt associated with obtaining degrees. So this is really a great opportunity for Ed to hear the voices and experiences of early childhood educators and other stakeholders as we think about this important public service loan forgiveness program. Comments are due on September 24th. And I will go ahead and put the link in the chat to the Federal Register announcement. So you can have information on how to direct those comments to the department. The second issue I want to highlight is the American Rescue Plan education stabilization funds, and particularly funds that are going to support elementary and secondary education in the COVID relief and recovery efforts. So the ARP included an unprecedented historic investment, $122 billion in funding to state education agencies and local education agencies to be able to respond to the challenges and address the diverse needs of children, families, and communities arising from or exacerbated by the COVID-19 pandemic. There are very broad allowable uses of funds, including being able to support the well-being and professional needs of educators, including early educators and staff. I think very similar to some of what Dr. Futrell was talking about in terms of uses with Head Start funds. States have submitted We've had 48 states submit their plans to the department for approval. To date, the department has approved 22 of these state plans. I'm going to also put the resource to where you can find your state's plan on the Department of Education website. And we are going to working on a review as we're looking through those. We are looking to highlight early childhood priorities in the state plan and be able to use those sort of for best practices and dissemination information, as we know which states are, highlighting and including early childhood education priorities as uses of these funds. And I think that will definitely inform our technical assistance efforts. I also want to remind you that ED does have a best practices clearinghouse. And there is information already around where states and communities and early childhood providers are sharing information around best practices to specifically also to support the workforce. So I'll share a link to that. And then finally want to mention that now that SEAs have submitted their plans for approval for these funds, the majority of the funds will go down directly to LEAs, and LEAs are working, local education agencies or school districts are working on their own plans for the funds. And again, the majority of the funds are going directly to school districts of these resources. So this is also a really great time to be engaging and connecting with your school district or other sort of local councils where your school district is maybe sitting at the table and sharing and work to align early childhood goals. The third point I wanted to mention is that there is a comment period that is closed related to Secretary Cardona's priorities for discretionary grant programs. So the department has many and numerous discretionary grants programs that can support early childhood work, including professional development and other opportunities for early childhood educators. And so one of the priorities that this secretary specifically invited comments on was, related to supporting the educator workforce. He very much sees early childhood educators as part of those goals, supporting leadership, supporting their leadership advancement opportunities, goals to diversify the workforce, improve preparation and other programs, and professional learning. So we are in the process of reviewing those priorities as a result of the comments that we've received. And then finally, we know we talked about this last month, but want to put in a final plug for the American Families Plan and the Build Back Better agenda, which last month, I know I shared information about the numerous proposals that are there that will benefit included in that plan. Dictated, really targeted towards addressing affordability and access to post-secondary education opportunities. So free community college, investment in minority serving institutions, other increases in the Pell Grant, that are all just really critical for being able to support our goals to create more pathways and opportunities for educators to advance including in post-secondary education and advance in their career opportunities. So with that, I'm going to put these various links and resources that I mentioned in the chat, and I'll turn it back over to Katie. Thank you.
Thank you so much, Miriam. We appreciate everyone sticking with us. We know we went a little bit over. We had a lot of just really interesting presentations and information to share with you all today. I'm going to make one last plug before we wrap things up, and that is we want your help in getting the word out about the child tax credit. There are enhanced benefits that are available to families with children ages 17 and under. Families are starting to get monthly benefits as an automatic deposit, but some families who did not file taxes last year will need to sign up in order to receive those benefits. So we want everyone to go to childtaxcredit.gov to learn more, to link to that IRS tool to sign up if you haven't already signed up. And we really, really, really could use your support in getting the word out to the parents you work with, the childcare providers you work with, the families in your communities. We really want to make sure that these benefits that families are entitled to get into their pockets. We know that families need these resources. So we really appreciate your support and asking everyone right now to share with your network, share on social media, and make sure the word gets out there. And with that, I want to just thank everyone again for your time, and we look forward to speaking with you next month. Thanks so much. Have a great afternoon.